Congratulations, Improve Care Now, on 10 wonderful, wonderful years.
I am so delighted to send my warm gratitude and congratulations to you on the 10th anniversary of Improve Care Now.
Congratulations to the entire Improve Care Now organization on the 10th anniversary. What a remarkable achievement.
My involvement in Improve Care Now began before the birth of the network. About 2003.
My connection with Improve Care Now began more than 10 years ago. In 2005,
I was diagnosed with ulcerative colitis in 2008. I didn't personally get involved until the spring of 2012.
I've been involved with Improve Care Now since about 2009 as a patient voice and patient representative.
I've been involved in numerous roles, starting with being an early member of the Patient Advisory Council, and most recently being a part of the Transition Task Force. It's been so rewarding for me as a patient to give back to an organization that I recognized early on as incredibly special and incredibly rare for the way that I was welcomed as a 19-year-old patient.
It's been an extraordinary privilege to be involved with it, not only in the early days, but also our site here at Nationwide Children's Hospital has embraced it aggressively. I could not be more pleased, proud, awed by the extraordinary accomplishments in the improvement of the lives of children and their families with IBD.
I ended up founding the Patient Advisory Council, which you now know to be much larger than when we first started out. And they've had such a great impact on the network and all the work that is being done across all the Improve Care Now centers that I couldn't be prouder.
Really, really wonderful and empowering to see this whole community of ICN. That everybody was so encouraging of that message of being empowered by ostomy and not ashamed by it.
I think the most important accomplishment of Improve Care Now is to be seen in the lives of patients and family members.
The statistics on remission in this patient population are really quite stunning.
The registry. How does this medication work for people like me who have disease where I have disease, who have had experiences like I've had?
I think the Improve Care Now is absolutely unique in achieving this holy grail of one-time data entry with really, really good quality so that you can use single entry data into a national database for managing patients on a daily basis, but also doing quality improvement, doing research to improve systems, and even doing clinical trials.
What Improve Care Now has demonstrated is a model of an innovative system architecture that links healthcare service and the development of new knowledge.
It has become a national model for a quality improvement collaborative.
Improve Care Now is a perfect example of changing the balance of power. Rather than looking at a clinical interaction as the doctor telling the patient or the patient's family what to do, changing the balance of power means that we begin to look at all of the assets within a patient and family, and we begin to empower them to take care of themselves.
They've carved out a space for patients and parents to be truly, truly engaged in the way that their physicians care for them and make decisions about their care.
there have been many accomplishments of ICN over the 10 years. I think one of the biggest is steady growth in both the number of clinicians involved, the number of patients involved, the number of care sites. The transition we made from starting off as an improvement collaborative that implied maybe it would end at some point to actually becoming a network.
There's something incredible about knowing that I'm here in New Jersey and you're there in Dallas and someone else is in San Francisco and someone else is in Maine, but we're all connected.
Doctors and nurses and psychologists and dietitians and social workers do really want to listen to patients and families and get their input.
Improve Care Now has been as successful as it has, largely because Improve Care Now has had curious, trustworthy leaders who have been working in partnership with patients and families.
There's a team of people who are working above and beyond their usual duties as caregivers to help a past version of yourself that still exists out there.
Steady leadership that promoted a good balance between strategic planning as well as opportunities as they became available.
I think that ImproveCareNow has been so successful is because of the energy level. Every time I had the chance to go to a learning session, there's just a buzz about the room and you can't get people to stop talking, and everyone is always really excited to be there and really excited to get to work.
You've done really great work in creating a model that I think is going to be useful for many other areas of medicine. And the Drucker Prize is a fitting recognition of the work that you're doing.
We as a community have not only improved quality and outcomes for children with IBD, but we've also had a great impact on other pediatric learning health networks, like the one for cystic fibrosis, autism, congenital heart disease, sickle cell disease. And I've also seen small changes happen in the adult IBD community as a result of the outcomes that have come out of our network and how we've shown what's possible in pediatric IBD care.
It has become a national model for a learning health care system in every sense of the word of Institute of Medicine's definition of a learning health care system.
The old separation of service and research is an outdated paradigm.
A good balance between quality improvement and research.
As an IBD patient, you know that research is the long haul. You know it takes a long time, but the research we do, the quality improvement efforts we make a difference in the here, right now. And that's awesome as a patient and as a clinician, I imagine, to be able to take what you're learning and implement it within the next 6 months and see positive results.
There are so many examples, but in these 10 years, you've made such a difference.
You are making ImproveCareNow successful.
Being involved in ICN has taught me that science and compassion are not divorced from each other, and if anything, you need compassion and you need a community.
When I take care of patients with inflammatory bowel disease, I am always excited to tell them that we are a site for ImproveCareNow. It gives them great confidence. They're gratified that we're part of this national research collaborative.
I went to medical school because of ImproveCareNow, so I would say it's had a pretty great impact on my life.
I think that one of the things that being a part of the network has taught me from more of a professional standpoint is that it's not scary to work alongside physicians and researchers, and it's definitely in everyone's best interest to work together as a team and on the same playing field.
ICN has influenced my work in quality improvement. You've set a standard for how an improvement network can function, both in who's involved and the outcomes they get.
My own thinking about the value creating contribution that healthcare service makes to health has been tested and sharpened by the ImproveCareNow model.
ImproveCareNow was born 10 years ago. You folks have taken it way beyond, I think, what any of us anticipated.
I'd actually expect that there will be about 50 more networks like ImproveCareNow, inspired by the lessons from ImproveCareNow.
In the next 10 years, I hope every ImproveCareNow center has patients and families represented on their quality improvement teams. And I hope we continue to develop opportunities for not only some, but all patients and families to have roles of contribution in ImproveCareNow.
I would like to see us look into the efficiency of care delivery and the cost effectiveness of IBD care, and I think ImproveCareNow can lead the way in this, just as it has in so many other areas.
Going forward, I think there's an opportunity to incorporate teaching or education into ImproveCareNow. I would love to see more medical students, more residents, more involvement of other learners in the health professions.
ImproveCareNow has come such a long way in the pediatric IBD world. I would love to see it expand to the adult world.
I'd like to see ICN be recognized as a leading organization in combining research and improvement through cooperation of clinicians, parents, patients, and providers, and demonstrate, lastly, that it is possible to reduce total healthcare costs while providing great care.
You've made a huge difference in so many patients' lives, and I can't be more grateful for the experiences that I've had as a part of the network.
You have changed so many lives already, and I know in the next 10 years, you're going to do the same.
We know what we're doing makes a difference. And we never stop, because we know that the goal always keeps moving. And we all do that with our excitement, our passion, and our ability to listen. It's really what the magic behind ImproveCareNow is. It's not magic, it's people.
Congratulations, well done. We look forward to so much more.